Hi, everyone, and welcome to the first episode of our podcast. We are recording live from our office in the Bradfield Center in Cambridge. So as you may know, we're a genomics platform with data privacy and transparency at our core. So the reason we decided to start this podcast is to help you to understand more about genetics, personalized medicine, and to try to bring you some great conversations with both expert scientists and patients working at the forefront of research in personalized medicine. So we're tackling a lot of different topics, including what you can and what you can't learn from genetic data, some exciting new research being conducted on our platform from both rare and common genetic diseases, and also different issues around data privacy and monopoly. How are companies using your health data, and what can you learn about how it works today? So part of our big goal and ambition here at Sano is to help create personalized medicine, and the way we're trying to do that is actually by bringing people closer to research. So instead of being a research subject or having research done on you, you're actually part of the research process, and you can help decide the goals from the beginning and also see how your data is being used and what's going to happen to it in the future. So we think that in the next decade, the nature of research and the way we do health is really going to change. It's going to become more personal. And a big part of that is actually by bringing patients and patient groups and people who are healthy now but may not be in the future closer to this process. And so a big part of our values as a company is transparency, data privacy, data ownership, and also not having other companies monopolizing your data. When we speak to rare disease patient groups, common disease patient groups, one of the things we almost always hear is that they want their data and their condition to be worked on as widely as possible. They don't want it to be monopolized by a single company. So we're going to be talking about a lot of these themes on this show: transparency, data privacy, data ownership, and a sharing model that actually aligns individual people and scientists towards a common goal of more personalized medicine. You may have heard of direct-to-consumer genetic testing companies like 23andMe or Ancestry DNA or MyHeritage. We're a little bit different from those kind of companies. So rather than focusing on kind of consumer products like ancestry testing or some of the tests on hereditary traits, we tend to focus on medicine and on research especially. So rather than making money as a company by selling reports or kits to people, we actually focus on matching patients and patient groups that are interested in seeing research move forward on their disorder with researchers who have the funding to perform genome sequencing and the kind of in-depth analyses that can take us from a world where it's one pharmaceutical or one treatment for many millions or thousands of people to one where we can start to be more precise with how we measure symptoms and how we measure treatment or effect. So we've got a lot of really interesting research happening on the platform right now. Some of it's in rare disorders like Phelan-McDermid syndrome, a rare neurodevelopmental disorder, so it affects mostly children. Also muscular dystrophy. We're working on common disorders as well, like psoriasis and eczema. And that's actually what we're going to talk about today because it's one of our most quickly growing and exciting research projects. So if you're not aware of the conditions, both psoriasis and eczema are primarily skin conditions. And some people, they can present as a relatively mild rash on the hands, on the feet, potentially on the knees or other parts of the skin, but in some people they can be very severe and cover a large part of the body. So both these conditions are very highly genetic, and what I mean by that is that a large fraction of the risk for these disorders is due to genetics, but it doesn't mean it's the only piece. As you all can probably appreciate, diet plays a role in especially the severity and timing of breakouts in either of these disorders. And also your environment, what the air quality is like. So like many common complex diseases, anything you can think about, type 2 diabetes, cardiovascular disease, there's an interesting and very complex interplay between genetic predisposition and what actually happens to you. So we're diving into a few interesting topics around eczema and psoriasis. So one of those is looking at direct-to-consumer genetic data from companies like 23andMe and Ancestry DNA that people upload to our site, and we compare to their symptoms, how severe is their psoriasis or eczema, which treatments are they taking, and use that information to better understand why do treatments work for some people, for example. and why are some people more susceptible to severe or plaque psoriasis, for example, compared to a more mild form. And then we also have some very specific research projects around psoriatic arthritis. So psoriatic arthritis is, as the name sounds, it's arthritis, so pain and swelling of the joints. But in people that have psoriasis, and it's not fully understood actually why people who get psoriatic arthritis do, but about 1 in 3 people who have the psoriasis skin rashes also get arthritis. So we're working with a great research group at Imperial College in London who are studying both the genetics of psoriatic arthritis and also the influence of the microbiome. So this is the gut bacteria, what's happening in your stomach, and how does that actually relate to the body's immune system and symptoms like arthritis. So the studies on eczema and psoriasis and psoriatic arthritis will be running for the next couple of months. It's primarily geared at people who have these conditions or have family members who have these conditions. You can, of course, go check it out if you don't, but it may not be as interesting to you. So if you are interested, you can go to our website. It's sanogenetics.com/skin. That's SANO genetics.com/skin. So you'll see information about the study on that website, the researchers we're working with, the timelines of the project. So as you can probably appreciate, sometimes research takes a long time, but one of our goals as a company is to actually keep you involved throughout the research project. So you won't just drop your information on the site and never hear from us again. We're going to give you updates as the research project progresses, and when we learn something or when the researchers learn something, we're going to take the time to share it with you, so you can see how all of your effort has actually moved things forward, even if it's just by a little bit at a time. So what are our plans with this podcast? So some of the episodes that we create are going to be really short and sweet, like this one, to tell you about one of the new research projects we're running. Especially if it's relevant for you, then you can get involved, or hopefully you can share it with someone that you know that might be interested. We're also going to be doing longer, more in-depth podcasts on some of the topics that we know people who use our website are really interested in. For example, data privacy and transparency. What happens with this data? What are the myths and what are the realities around how data is used in health? Other questions around the validity of genomic tests. So you see dozens of direct-to-consumer genetic testing companies today. We're going to try to take the time to go through some of these examples and discuss what the science actually says, which of these tests are really groundbreaking and exciting and useful information, and which ones are a little bit more on the pseudoscientific side. And finally, we're also going to be getting some interesting guests on to do interviews. So some of these will be scientists that are working on precision medicine, clinical trials, rare disease, genomics, and others will be people who work in other parts of the health ecosystem, and also patients themselves who've participated in clinical trials or other interesting experiences that they've had related to genomics or genomics research. So in a nutshell, we're going to try to help you understand a little bit more about the world of genomics, answer some of the questions you have, and we'd love if you got in touch at any time to tell us what you're interested in. You can email us at podcast@sanogenetics.com. That's SANO genetics.com. We look forward to hearing from you.